Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 18 new cases of COVID-19 in Windsor and Essex County. 5 are close contacts of confirmed cases, 4 are community acquired, 1 is outbreak related, and 8 cases are still being investigated. We have had 16,590 cases since the beginning of the pandemic. 197 people are active at this time, with 101 of our cases being a variant of concern. To date, 1,802 people are preliminary or confirmed variants in Windsor-Essex County. 1,665 cases are identified as the UK variant, 4 cases the South African variant, 5 the Brazilian variant, and 2 cases have the B1617. 11 people are currently in the hospital and 6 people are in ICU. Our community has lost 427 people to COVID. There are currently 10 active outbreaks in Windsor-Essex County, 9 workplaces, and 1 community. Regarding the vaccine update, 280,346 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 250,857 people have received at least 1 dose. Overall, 71.2% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. Residents of Windsor-Essex County 12 years of age and older are able to book their vaccine appointment at one of our mass vaccination sites. Seniors 80 years and older are now able to book their 2nd dose appointments. Family and friends are encouraged to help their loved ones book their 2nd dose appointments. Please note that you do not have to book at the same location that you received your 1st dose. You can book your appointment at wevax.ca or by calling 226-773-2200. People are also able to receive their 1st dose of vaccine at a participating pharmacy or primary care provider. Select pharmacies are offering 2nd doses of AstraZeneca. Please visit wechew.org for a list of pharmacies. Yesterday, we immunized 426 youth and their families at a pop-up clinic at the Atlas 2 Recreation Center in Lakeshore. A special thank you to the municipality of Lakeshore for their support in hosting this clinic. Please be reminded that on Thursday, June 3rd, another pop-up clinic will be held for youth and their families at the Essex Center Sports Complex in Essex from noon until 7 p.m. If you do not have a copy of your vaccine receipt and would like one, you can log on to the ontario.ca portal and download a digital copy. This link will be posted on our website at wechew.org later today. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. Yesterday, the National Advisory Committee on Immunization, or NACI, made their recommendations on the interchangeability of the authorized COVID-19 vaccines in Canada. We're still waiting for the provincial recommendation on the interchangeability and the logistics of how it will be implemented here in Windsor-Essex. We will share the information as soon as it's available and we can operationalize it. In the meantime, I want to make sure that our community is aware of the NACI recommendation and my recommendation as the local medical officer of health for Windsor and Essex County. So for those who have received the mRNA COVID-19 vaccine, which includes the Pfizer or Moderna, they can get a different vaccine, but preferentially our recommendation is they should get the same vaccine as their 2nd dose to ensure that they complete the series with the same vaccine. For example, if you have received Pfizer vaccine as your 1st dose, you should get Pfizer as the 2nd dose. On the same note, if you have received Moderna as the 1st dose, you should get Moderna as the 2nd dose. In an exceptional circumstances, that is due to some kind of a reaction to one vaccine or the non-availability of one type of the mRNA vaccine, it is okay for people to use the other type of mRNA vaccine, but we will try to make both vaccines available locally as best as possible to ensure that everyone complete their vaccination series with the same vaccine. This recommendation is based on limited data on the interchangeability of the mRNA vaccine, but recognizing that how the mRNA vaccine is working, they're using both the spike protein, which is the same mechanism that each of these vaccines operates. So there is not a lot of data on switching the vaccine from Pfizer to Moderna or Moderna to Pfizer or vice versa. But based on the expert recommendation, this is a recommendation that is possible. And because of the interchangeability of this vaccine is similar to some of the other vaccines that we use quite frequently in our practices, such as the hepatitis B vaccine, such as some of the other vaccines that we have used in the past. So interchangeability of the same type of vaccine is not necessarily an issue, and it is possible. So based on that, it is possible, but as we have said, preferentially, we recommend people who have received the same mRNA vaccine, they should get the same mRNA vaccine. For those who have received AstraZeneca, like we have always said before, that they will have the option to finish the series with either AstraZeneca or to switch to an mRNA vaccine. So now with the additional data and the analysis, NACI and RACI recommendation, I feel more comfortable to say that people who have received AstraZeneca vaccine as their first dose, they now have the option to choose for an mRNA vaccine once a provincial direction is made. But if you have received mRNA, those two options are, if you have received AstraZeneca vaccine and choose to receive the mRNA vaccine, please note that, based on the clinical trial data, these individuals may experience side effects that's more intense due to the immune response of changing one of the vaccine. We're not talking about the severe disease. We are not talking about any kind of severe adverse reaction. These are all the local reaction, but it's a more pronounced local reaction to the vaccine that happens all the time, including redness, swelling, pain, or fever. So some of those common reaction. So please note that would be a possibility if you choose to switch from an AstraZeneca vaccine to an mRNA vaccine. But for the most part, in terms of immunogenicity or immune response, your immune response will be similar to what you would expect in a fully vaccinated person. So interchangeability, it's possible with some caveats, as I mentioned, and we will share further information in terms of operationalization of how we will operationalize it based on the provincial guidance, and we'll continue to share the information with the rest of the public. Thank you.
We'll now take questions from the media. Today we'll start with CFTV.
Yes, good morning. You are saying, Dr. Ahmed, that the Pfizer and the Moderna are the same, basically the same vaccine, if I'm understanding correctly. What is the difference between the two?
So those are the two vaccines. They use the same mRNA protein, spike protein, to generate the immune response. Those are two different companies that are producing these vaccines with different type of stabilizing material that helps to stabilize the mRNA spike protein or mRNA protein to trigger the immune response. So otherwise, other than that, it's the same vaccine. It uses the same mechanism that triggers the immune response in a body to identify that spike protein, that the mRNA spike protein is triggering that system in the body. And then when the body recognizes that spike protein, it develops the antibodies against that. So that's how it works. They both use the same one. The AstraZeneca or the Janssen, they use the viral vector protein, which is slightly different than what the mRNA protein is. So it's just different companies producing the same materials.
Okay, thank you very much.
Any questions from Blackburn?
Yes, they do.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Are you still accepting people onto the wait lists, either for first or second doses? I checked the last few mornings, and every morning, even early on, it says the wait list is full.
So I can comment on that. We do have the wait list is still available. We are needing less people on the wait list because our clinics are, are completely full and people are attending them. So we're getting less no-shows and people actually attending for their appointments. So the wait list where we were accepting about 100 to 150 people every day to accommodate no-shows across the sites, we're limiting it to, I believe, about 50 a day now, because that's all we really need. And we don't want people to, join the wait list and think they're going to get called when we know that our cap seems to be about 50 people right now. So that's why you're seeing that it's full.
Okay, thank you. And then separately, do you have an update on the outbreak at the jail? Is it close to being rescinded, or are there new cases?
I am
Great question.
trying to look.
Yeah, and I think we had the update, and Taylor, maybe I'll just send you a response after this call, instead of trying to find it right now. I'll definitely do it, okay?
Okay, thank you. I'm just wondering, I know with the Mission and Salvation Army outbreaks, you were giving us updates regularly on how many cases were involved, the number of them. I don't know if that's possible with the jail, even if how many are active, but I'd appreciate that information if it's available.
Sure, sounds good. I'll find that out and we'll connect with you.
Thank you.
Any questions from AM 800?
I'm just wondering, with the status of the vaccination clinic opening up, excuse me, at Sears, if you'll still keep all of the ones in the county open in Amherstburg and in Leamington, considering that we're coming up on people being able to schedule and receive their second doses? Is there still a need to have that many vaccination centers open?
So right now, yes, we are filling up all of the vaccine sites that we have available. The transition to Sears, we are in discussions to make sure that people still have access to the same amount of appointments as they did before, because Windsor Regional Hospital was doing the Sportsplex and Windsor Hall, and that was quite a substantial amount of people getting done. And so we are having that exact conversation to determine when would be the timing to move from the mass sites in the municipalities and exclusively use Sears and our partners at pharmacies and primary care providers. So that date and the timelines are not quite there yet. We do know that based on the amount of people that receive first doses, that we do have we're expecting the same amount of people to access clinics for their second doses. And right up until mid-August, there's substantial amount of people that require second doses. And so the use of mass sites is still very efficient, and with the support of the municipalities is a good channel to keep open for those large amount of people.
Following up a little bit on the question I recently asked about how long we will have to continue tracking COVID-19 the way we do now, do you see a point where, obviously after maybe herd immunity or so many people have their second doses, that obviously we won't have the mass vaccination clinics, but COVID vaccines will still be available either through the health unit or through a physician's office?
So right now, the health unit tracks infectious diseases, and they call them, diseases of public health significance, such as tuberculosis, the influenza, hepatitis A, hepatitis B, all sorts of diseases. I think there's like 68. So you can imagine that when all this is settled and the pandemic is over, that COVID will be one of those diseases. So as new cases come in, they will be followed up by public health staff, as we do now with other diseases of significance. And so there's contact tracing with other diseases, isolation, also, all of those, that kind of follow-up. So that will probably continue. So right now, it's too early to tell because the numbers are still very high. So to have a group, in normal times, our group might be 8 nurses, say, following all of these diseases. So when you have COVID that we're getting 15, 18, 20 cases a day, that's a substantial amount of number. of people to follow up with. So at some point, the vaccines will become a more normal process through primary care and pharmacies, and you can, and it may be similar to influenza. I think all that information is yet to be released, but based on what we've done with other diseases in public health, when things are in a more controlled state, I can see it being followed up as we would other diseases. I don't know if that really answered your question, but this is the work of public health, and we're used to doing this with other diseases.
No, of course, that's very helpful, because I just wonder if, I think like 12 is the age right now, as young as 12 can get the vaccine. So if you foresee the COVID vaccine being something that's added to that list of vaccines that kids would get, like when they turn 12 or the year that they turn 12.
Well, and regarding the children, so right now, any of the vaccines that we provide to students that are going to school is through the Immunization of School Pupils Act. And so in that act, there are certain vaccines that are required to attend school. So say at some point, COVID is a vaccine that's required to attend school, then our health unit would be involved. And even though we haven't done it in the last year or two because of the pandemic, suspensions and all of that work is really based on having complete vaccination records for students that attend school based on the law, the Immunization of School Pupils Act. So we'll see if a COVID vaccine will eventually be included in that act, or if it just becomes not mandatory, and then it will be like the flu vaccine, where we strongly encourage it. It may be something you need every year for proper protection, and have that available through pharmacies, primary care providers, and some limited health unit vaccine clinics. Right now, even for flu, we're not doing those big, huge vaccine clinics we used to do, because the pharmacies and primary care providers have done an excellent job in getting that out to our community. So more to follow. A little early yet to tell how it'll all unfold, but I think we can anticipate some of this will be answered in the in the months ahead.
Thank you.
Any questions from CTV?
Yes, good morning. Dr. Ahmed, I know you have said in the past that you support in-class learning to return in June. So will you be disappointed if the government in fact announces today that it will not resume until September?
So I think, as I've said before, that there is no risk-free option. There is a risk in each of these settings, and my job here is to make sure that I'm doing a good risk communication to the public, and I'm doing a good risk assessment to the public. And if the risk is high enough, then obviously it's my responsibility to make sure that I protect my community and take appropriate action as needed to ensure the safety and well-being of our community. Having said that, we know that with our high vaccination rate, with our teachers vaccinated some time ago, and now our students are getting the vaccine, our active case counts are going down, our daily case rates are going down as well. I feel that it's a much better place to return to in-person learning. There is a harm in, as I said, in everything that we do. The children who are not attending in-person classrooms, a lot of them are struggling with the connectedness, with the learning environment that is important for them to learn. So the mental well-being is definitely getting impacted, and to find that right balance, I think it's important that we need to carefully measure the risk and benefit of either of the option. So my recommendation has been there, which is there for our local community based on our local situation. And but as I said, there is no risk-free option. So we'll wait and see what the province will formally announce. I haven't seen any formal announcement yet. Everything that I've been looking and reading, it's on through the media rather than having any direct communication with the province.
Okay, thank you. And do you have an update on the survey for people who received a vaccine out of province?
So the last time we updated was a few days ago, and that Teresa shared that information. That was close to, I think, close to 2,000 people that responded to our survey. I don't have any update, and I think we'll probably provide an update on Friday when our EPI will have the chance to summarize that information.
Okay. Some of the local postal codes with the highest positivity have the lowest first dose vaccine coverage. Why is that, and what else can be done?
Well, I think the coverage rate is increasing everywhere, and we have always made some of these clinics location selected based on the areas that was highly impacted by COVID. So even our downtown clinic, the Windsor-Essex building, the WFCU, the St. Clair College campus, the Leamington clinics, all those clinics were strategically placed in areas that have seen a higher case rates in the community to allow and offer these individuals an opportunity to get the vaccine. The hotspot strategy was targeted just in that sense to give better opportunity or to give more opportunity for people to receive the vaccine. And on top of that, there is this provincial funding, and that's in place, that's led by our partners, the CMHA and the city, co-leading that strategy to target these hotspot community to support their vaccination efforts, and also to give wraparound services to this community. So there is some work that's going on, but it's not unusual to see the slightly lower vaccination, and our health unit is working closely, collaboratively with both CMHA and the city to work closely with this community to target those communities where we have lower vaccination rate and higher case rates, just to provide that level of support that they need. And that work will continue to go on despite our as we are seeing the rest of the community having a higher coverage rate. We will continue to target those communities, but that work is currently led by CMHA and the city in these high priority neighborhoods.
Okay, thank you.
Any questions from CBC?
Yes, can you elaborate on what the response was to pop-up clinic in Lakeshore yesterday? 426 people, is that around what you were expecting? Did the clinic use all of the vaccine that you had allotted for that site?
So we had set aside about 500, like that was our estimate, 500 doses. And so we didn't quite reach that, but all I know is the number. It did go to 7 p.m. last night. And I believe that early on there was a little bit of a lineup, and then people were quickly accommodated. And then it slowed down early afternoon, and then picked up a little again. So I don't really know much more than that, other than, the overall number. But the site itself, when we saw it all set up, it looked great. Our municipal partners at Lakeshore, were really, really amazing to help us with such quick notice. But so I think it went well, and it was an inside clinic, so weather wasn't a factor. Thursday is tomorrow, and it may rain, but again, it'll be inside. So we hope people will continue to access that opportunity to get vaccinated for their 12 to 17-year-olds and any family member who's over 18 that hasn't been vaccinated yet.
Thank you. And is 500 vaccines the plan for Essex tomorrow as well?
Yes, that's the number we're using, because we know that we can safely do that amount within the time frame we have. So that's kind of the gauge we're using.
Thanks very much.
Any additional questions from CFTV?
Yes. What are the times on the pop-up clinic in Essex tomorrow, just in case anyone's forgotten?
So for Essex tomorrow, it's noon till 7 p.m.
Thank you so much.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, can you comment on the vaccine uptake among youth aged 12 to 17?
I can tell you what I saw yesterday. So we know that we probably have around 21,000 youth in this age group. And that as of yesterday, we had about over 7,000 people that were vaccinated. So we're about a third of the way through of those that would be eligible. So I don't know the exact number, but I did see it, and it was over 7,000.
Is that what you'd expect for how long they've been eligible? Would you have expected it to be more or fewer?
Based on the accessibility and with our clinics and the fact that we're doing second doses with 80 plus and this age group, I think it's good, but we want everyone vaccinated. So, it can be better, but just hoping that people continue to get vaccinated in that age group. So we'll have updated numbers as well, because yesterday, was a big day. So we'll see how many more people got added to that actual age group.
Yeah, and I think from my perspective, we historically have got great coverage rate in the school age children for the vaccine. So hopefully we will get to that 90% plus range with these younger population, recognizing that how dangerous this disease could be if it continues to persist in our community. And so that's my comment about that. But on the unless you have another question on the same topic, I can go back to and respond to your Southwest Detention Center question.
Just to clarify, that 90% uptake with that age group, is that mandatory vaccines for school age children?
Yes, so we have got a range from 80 to 100% or 99 or in the 90% for the mandatory vaccination that we have in the school system. It ranges from vaccine to vaccine. So hoping that with the pandemic that has impacted our community and our children and everyone have been impacted by it, the school was affected by it. So we are anticipating that there will be a high uptake in that population. So I'm hoping that 90% would be something that will have a coverage in that age group.
Okay, thank you, Doctor. I'm happy to hear what you have to say about the jail.
Yeah, so the Southwest Detention Center, we had a total of 14 cases so far since the beginning of this particular outbreak. Right now, the active cases are only 2, and we are hoping that in the next few days, I don't want to give you an exact date because things change, but it'll be at least a few days before we can rescind it, just based on the last case that we have seen in the facility. But so far it's going fine. We haven't seen a crazy number of cases, and it has been fairly well contained. And we're continuing to work with the facility to rescind the outbreak as quickly as possible.
Are you able to share with us a breakdown between inmates and staff cases?
So it's a split between the two. So I don't want to give you the exact number for just from a privacy perspective, but I would say it's a good split. It's pretty much similar between the two groups.
Okay, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
Yep, just one more. The number of active cases have dropped below 200, and the new cases are also declining. Does that give you a sense of accomplishment and that things are headed in the right direction?
Absolutely, and I think this has been a success for our community, especially in the third wave. I think we dodged a bullet because of our high vaccination rate and our community sticking to the public health measures. So I think it is important that we are in a better position, and in this particular wave, we were able to even support some of the other communities that have been hard hit. So I think it's a kudos to the entire community, and we're really looking forward that we continue to bring the active cases down and our daily case rates to low and increase our vaccination coverage rate. So I'm very optimistic. I'm very confident that we will be in a much better spot on June 14th or the week of June 14th when the province will move to stage 1 of the reopening.
Great, thank you.
Any additional questions from CBC?
No, thank you.
Thank you, everyone. Have a great day.